Hey,
You.
good. How are you? Thank you so much for doing this.
Yeah, anything that is pertaining to this, I'm just like ready for it. So.
Good, good. But yeah, so basically what I wanted, because I've made several posts on my Instagram about how I hated being pregnant and
Mhm.
how it was awful and like just being honest about it. I've gotten a lot of people that will either DM me or comment back and say like, thank you for saying this. Like I never felt comfortable saying this. Everything you hear is how it's always beautiful and women love it. And that wasn't the same for me. And finally someone is saying what I felt. And so I was like, maybe I should make this video and bring you on and actually, have not just my own emotions, but like some real like data behind some of this or just an expert's opinion on some of it because other women are feeling the same way. And I can't be the first one to have voiced this, but if I am, I'd like to give somebody else like the outlet to know that it's okay to hate it because I hated every minute of it.
Yeah, and I can relate. I have two children. The first pregnancy I loved, but that's because it went smoothly. But not every pregnancy goes smoothly. And sometimes, even if you don't have any problems, sometimes you still just don't like being pregnant because there's a lot of changes going on. It's uncomfortable. And it's a lot. It's a lot to take on. And so with my second pregnancy, I hated it as well. So I definitely can understand how a lot of women just aren't happy with that experience. And it is okay to say, you know what, it's not exactly what I thought it was going to be.
Yeah, yeah, and that's exactly it for me. Like we planned out the pregnancy. It wasn't like a surprise for us. We were actively trying. And turned out I absolutely hated every minute of it. And my husband's like, I thought we wanted this. I was like, we did, and we still want the baby. We just don't want these 9 months anymore.
Yes, and we a lot of times we do love our children, but it's just the process of getting there
Yes.
is what makes it difficult.
Yeah. Yeah. And it got to the point where he felt so helpless. He's like, I don't know what to do anymore. I was like, well, I'm just gonna, if this releases you, stop trying because I don't know either. And you're not going to upset me if you don't know, because I don't know. We're just along for this ride and just gotta get through it.
Yeah, I think the significant others or the partners struggle as well. And I don't know if you've seen the statistic where it's like 1 in 10 men have perinatal mood and anxiety disorder. So a lot of people don't necessarily consider the partner in the situation, but a lot of times, if you're not the one that's pregnant, you really don't know what to do, and then your heart just breaks for your partner who is pregnant because you're like, I just want you to be happy. And so it can be quite difficult and upsetting for both parties involved. But I think it is important for us to also let our significant others know, like, look, there's only so much that you can do.
Yeah.
You don't have a whole lot of control over my personal, moods and emotions and thoughts about it. So just being there and just being someone to talk to can definitely be the best way to support somebody through those types of thoughts and emotions.
Yeah. Okay, so I'm gonna kind of just like jump into my story, and then I'll kind of give you parts to come in and say like if you have a statistic, throw it in there. If this is common, talk about it. So just kind of put in your expertise.
Okay.
Okay, so there's a part of my pregnancy that I did not share online. I'm going to share here because maybe someone else has went through it. Um, I was pregnant with twins and lost one. But I didn't share that because I didn't want I didn't want sympathy because I wasn't sad. And so I didn't want other people to be sad for me when I wasn't sad at all. The same day I found out that it was a twin pregnancy, the exact same day I found out it wasn't going to continue to be a twin pregnancy. So there was never a chance for me to even think, oh, twins. It was like, okay, we got to get this one to survive. And we held on to one.
Yeah.
And so I didn't want sympathy because I wasn't sad. So I didn't share it. But that skyrocketed my HCG levels because my body was preparing for two. And it took maybe till about 20 weeks for my level, like my HCG levels to level out to a single, like a single pregnancy. And so I had, more hormones in my body than what I needed. And that may have contributed to how bad I felt. I'm not really sure. My doctor didn't talk about it much. He just told me it's vanishing twin syndrome. It happens. We're just hoping that this other one is going to be okay, basically. But so I would say my sickness started at about 6 weeks, 7 weeks in the middle of there. And when it started, it came on strong. I was throwing up 10, 11 times a day. I couldn't keep anything down. I was in bed. I was crying. I was trying to figure out what can I eat that will stay down. And it really, from week 6 to about week 26, 27, it was really a gamble on what will stay down today and what won't. And it got really frustrating. So like, try crackers. Did you eat ginger? Do you have ginger tea? Do you have ginger juice? Did you eat toast? Y'all, you have no idea how hard I have tried to everything. There's nothing you can come up with that I haven't tried.
Yeah.
So it was awful. It was all day long, every single day. And I thank God for COVID because it let me just stay home. Otherwise, I know myself, I would have tried to work through that and made it worse. And so what I did with my counseling sessions was I scheduled them an hour apart, which isn't normal. They normally be like 10 minutes. So I keep it together. Like, Brittney, you got to focus on the client. Do not focus on how you're feeling. Keep it together. And then I had an hour to just let my body do whatever it needed to do. And then I try again, get it together for an hour, focus on this client. You got this. And then I had another hour to just let my body. So that was really, really hard.
Yeah.
And learned later that it was hyperemesis gravid, whatever, that word.
It's a hard word to say. I struggle with it too.
HG, an HG pregnancy. So can you talk about that? Because I never.
So actually I had that as well in my second pregnancy, probably through the entire first trimester. And when we're pregnant, we kind of expect to have some nausea, some vomiting, but not to that extreme to where it's just like you're almost afraid to eat anything, and that can kind of create a whole other level of issues and, problems with your nutrition and the growth of the baby and all of that. So definitely I experienced that as well. And it's very common for a lot of women do experience that. And I'd say that probably is one of the most stressful problems that can contribute to having just a perinatal mood and anxiety disorder, because you're so afraid of, what you can eat, what you can't eat. You're disappointed because you can't. So you have those cravings, and sometimes your body is just like, sounds nice, but nope. So it can definitely put a strain on a pregnancy, and then just your overall mood in general, because nobody feels good after they vomited, especially all day long, or if they constantly have like a gag reflex, which is what I had. I had a constant gag reflex. And in the middle of sessions, I would have to stop and be like, hold on a second, and try to like keep myself from expelling everything. And so it definitely is difficult. But thank you for sharing that, because most people keep that to themselves, especially when it comes to loss. And when I miscarried in 2017, I've actually realized that there were so many friends and colleagues and people that I knew that had experienced the same thing that I experienced, but people don't say anything about it. And so I think people seeing you talk about this, and I think the more people come out and talk about their emotions and their losses during what is supposed to be a happy time, I think we can destigmatize perinatal mood and anxiety disorders, and destigmatize miscarriages and all of those things, because it happens. It's super, super common, and it's, nobody's fault. It just is it's a part of nature. Yeah. It's very natural to have it, and our body does amazing things. When I miscarried, it actually made me feel like, wow, like my body is really amazing, and like I'm super strong to be able to go through this. So I was able to look at it in a different light, rather than just solely a negative. Even though I was sad, I still was able to look at it from a different perspective.
Yeah. I think if I don't know if afraid is the right word, but it's the only word that's coming to mind right now. If I wasn't afraid of what people would think of me for not being sad, maybe I would have said it. But I truly had no emotion around it. My heart and my emotion went straight to the other baby. Okay, I need you to survive too. Or not too, but I need you to survive. Because I had already known it wasn't going to happen. And so I don't know, I guess I didn't want sympathy along with, why are you not sad and I'm sad for you? And I'm like, well, don't be sad for me. So I was like, let's just not share it. Yeah. And so that was easier, because then what happened, and I'm a trained therapist and I completely missed this, but depression set in for me, like completely. Being that sick, I guess, is what did it. I was afraid of food. And I realized later that a lot of my fear was completely surrounded around food. I desperately wanted to eat, but I was so scared to eat. And that, I would try to have dinner with my husband. And I threw up every dinner we had. But that was really the only meal that I would try and put together, and like, so I could eat with him and enjoy something. Otherwise, it was, what can I snack on here? What can I, the rest of the day was just snacking. And I would try one meal and I couldn't keep that down either. But depression set in, and I guess just me having the knowledge of depression and knowing what it is, I tried to look at it from a logical standpoint and not let myself look at it from an emotional standpoint. And I did nothing about it. I didn't talk about it. I didn't get help for it. I just was like, this is all that it is, Brittney. You're going to be okay. You just have to get through this. When I truly needed support, and I didn't, let myself get it. And that's on me. But what happened, the part that's really frustrating, is I had thoughts of terminating. I wanted to end the pregnancy, even though we had tried. I told you we were actively trying. And I still thought about terminating. And I love my husband, because he's like, look, if this is what we need to do, I'm on board. Maybe we'll try again later. But if you do this, you're not I don't want you to say, no, we won't terminate because you're thinking about my feelings. This is all of you need. And I had to explain to him, I'm telling you to be honest with you about how I'm feeling, but I don't go through with it. But these thoughts in my head, and they won't go away. But we're not going to a clinic to do this. It's just why are these thoughts here? So that was frustrating, because it was automatic thoughts. It wasn't something that I wanted, but they wouldn't go away.
Yeah. And that's another kind of taboo subject is termination.
Yeah.
Whether it's spontaneous or elective abortion, a lot of people are just like, ooh.
Yeah.
But that's a common thought. I remember when we were pregnant with my daughter, she they told us that she could possibly have Down syndrome. And so that was something that we discussed very seriously, that if those test results came back positive, that we may possibly elect to terminate the pregnancy for a number of reasons. You don't know the quality of life of that child, the stress that it puts on the parents, the amount of money and resources it takes to provide and care for a child with, any type of disorder. And so we thought about all of that. And fortunately, the test came back negative, but that was definitely something that I struggled with coming to terms with, and worried about what other people would say or think if that was something that we decided to do.
Yeah. Yeah. And even with that, you already had a son, and the neglect that he would feel with all of your time and resource going into, their sibling.
Mm-hmm. Exactly. It's so much more to think. You don't want to do that, but you have to consider the big picture. And that may be a conversation for another day. I think we think more so as from a religious or a moral standpoint, instead of really thinking seriously, logically about how much that's going to put on everyone involved.
Right. Yeah. And I would say that topic is something that would be judged so harshly by other people. Yeah, like that. Oh man, like that would be awful just hearing the thoughts of everybody else. And it's like, this is my life, this is my family, this is decision. You think this is an easy decision for us to make? Yeah.
Right. And I think that's why I'm glad that we're counselors, because people, like, we do see it from a different perspective and in a non-biased way. And, regardless of what our personal beliefs may be, if somebody were to come and sit in our chair and tell us, hey, I've thought about terminating my pregnancy, we can understand where they're coming from and know that that's not an easy decision to make.
Yeah. Yeah. And so for me, I told my doctor, this is how I'm feeling. This will not go away. The sickness will not end. And I was in his office at 14 weeks, and he's like, oh, this isn't morning sickness anymore. Then what is it?
Yeah.
What's going on? And he's like, you're just having reflux. I'm like, this is not reflux. This is full on projectile vomiting. This is not reflux. Mm-hmm. And he's like, I'm going to take you off of the, he had put me on medicine. I tried 5 different medications to help me manage the sickness that I can eat, because I was losing weight. I wasn't gaining weight. That's how sick I was. And he took me off of it because he said, no, you're at 14 weeks now. This goes away. Mm-hmm. Then, okay. I was angry. And so 3 days after he took me off the medication, my husband took me to the hospital. I was dehydrated. They had to give me fluids. They gave me medicine through the IV to help me stop vomiting. I'm like, yeah, reflux my ass. Excuse my language. But I was so angry. And so they gave me more medicine at the hospital, and they told me, go back to your doctor to, get a new prescription. You need to be on this. I need you to tell him that. So I decided to, it took me about another week to make the decision fully that I was going to switch doctors. And at 20 weeks, I was in the new doctor's office. And I was like, if you don't believe me that I'm this sick right now, you're not going to believe me if I'm having pain or I'm having extra bleeding or, something's going on later on down the road when it's time for birth. And I was like, I'm not going through that with you.
Yeah.
So I switched. And the new doctor put me on more medicine and helped me through it. I was on nausea medication until 32 weeks.
Okay.
And then I gave birth at 34 weeks. She came early. But the entire pregnancy, and I had that doctor in the beginning say, "Oh, that's not what this is." Okay, thank you.
I think that definitely adds to the struggle is when your doctor doesn't support you or isn't understanding or doesn't take what you have to say into account. And I can understand how, you're the provider and you have definitely years and years of education and experience that we don't have as layperson, but you still have, I think a lot of times medical providers miss that component of being compassionate and just taking feedback from their patients. And that's one of the things that I try to work on. There's an organization called 2020 Mom, and they actually, that's one of their goals is to educate medical providers on how to deal with this particular population, and be more aware of mental health and how some of their decisions and just the pregnancy process in general can contribute to these mental health disorders, and just making them more aware and keeping that in the back of their mind when they are dealing with pregnant women.
Yeah. And the new doctor, my very first appointment was an hour long, and 45 minutes of that was him just talking to me and listening. And it wasn't, he sat there for 45 minutes. It wasn't this 5-10 minutes, oh, I gotta go to the next patient. He didn't even look at the door. Like it was truly focused on me, and that was a completely different experience. And it wasn't like, because I know with midwives, you get the experience from what I hear is like 10 times better than an OB. But this wasn't an OB office. He had other clients, patients. He didn't get up. And so sorry to the people behind me, but I know they were waiting, but he sat with me, and I truly appreciated that because I got new medication. I got somebody to actually listen to me. He told me that it's not as common for it to last that long, but I'm the only pregnant woman that it has lasted that long for. These are the things you can do to help you get through it. Hopefully this medicine works. If this doesn't work, you call me in a few days and we will figure out what the next step is. He gave me his cell phone number. Like it was a completely different experience, in that I think kind of lightened my mood at like 21 weeks. I felt a little better emotionally, not physically, but emotionally I was feeling a little bit better. It felt like, okay, this makes sense to somebody, and maybe I'm going to get, the help that I need. And he's the one that told me about HG, and what that is and what that means. And he's like, you're 20 weeks in, and I would have liked to have, seen you at your, 6 weeks. You started here with me so I can fully diagnose it, but I'm just going based off what you said and not being able to see you, and that's what it sounds like. And so it got better switching to the new doctor. But yeah, I don't know. It was even though the doctor got better, everything physically I was feeling really didn't. And so it was still an awful pregnancy. But he made me feel like, okay, I can get through this. We're almost there. I can get through it.
Yeah, sometimes that makes all the difference, is just switching the doctor, or just having somebody in your corner that's like, I believe you. I see you. I'm trying to understand your perspective, and that can definitely make it better to a certain extent. Pregnancy is very uncomfortable. There's a lot that goes along with it. But I'm glad that you were able to find a doctor that was more supportive.
Yeah. Before I had found him, I just seeked out other women on Instagram and just social media and talked to them, and a lot of them were very supportive. There was one that really upset me though. So like we had DM'd and had a few messages, and there was one post that she had commented on, and beautiful post, or that she had posted and I had commented on. So beautiful post about her pregnancy and how she was happy. And, I'm so happy for her that she got that experience. And, just talked about how beautiful it was and how she was feeling. I think it was like a belly picture, trying to remember, I don't remember, but I commented on it, and this is me being depressed, because maybe I wouldn't have normally commented on a happy post with my own emotions. I don't know. Anyway, I just put how I was waiting for what is supposed to be the joys of pregnancy versus maybe commenting on her experience. I, brought in my own negative experience. But anyways, a few weeks after that, she had made another post talking about how people that are having, I guess, bad pregnancies or seeing pregnancy negatively needs to just change their mindset and put a whole like think piece on mindset and how if we just change our mindset, things get better. And then she even quoted like my comment and was like, people are telling me they're waiting on what's supposed to be the joy of pregnancy, and maybe your joy is just different from mine. This is not joy. That's not different. Mine is not joy. And so that really upset me that she would make an entire post about mindset when nothing I was going through was a bad mindset.
Yeah.
And not that she was supposed to know that, but I guess what I was expecting from another woman is that we listen to women and we believe them and we give them a voice and we don't silence them. And what that post felt like was silencing to women who may be going through what I'm going through.
Yeah. I complain. Yeah.
Yes. Yeah. And that's what it was like. And it, your joy is different from mine. I'm like, for some people, it's not joy. Like, don't use that word and make it different. And so for me, it wasn't a different joy. There was no joy. And I think I got angry, not just for myself, but for other women who don't speak up in the way that I do. Because you just silenced a lot of people with your mindset post. And like, that's not fair.
Yeah. It's not that easy. It's not as easy as just saying, you need to feel better. I wish it was.
Right.
But it's not that easy. And I think a lot of people, they miss the fact that everybody has expectations about what their pregnancy is going to look like, what's going to happen in delivery, what their child is going to be like. It may not be like completely accurate, but we have expectations. And then when those expectations aren't met or they turn out a little differently than what we expected, it's disappointing. And I think if we understand that, then we can be a little bit more compassionate with other people when they say that they're not enjoying their pregnancy because it's not what they imagined it to be in their head.
Yeah. And maybe I wouldn't have gotten as upset with her if she had, 500 followers, but she has 100,000 followers. You silence maybe a third of your followers because they're women. You're a woman. You post about mom stuff. You post about beauty stuff. You post about hair stuff. Your followers are women. You silence a third of 100,000 people with your mindset posts. Like, that's not fair. And like, I just didn't like her using her platform that way because there was nothing about being sick and being sad and being upset about my pregnancy that I would chalk up to mindset.
Yeah. Exactly.
Yeah. So I unfollowed her.
Well, good for you. We have to block people, unplug. I tell people all the time, if you have to unfriend somebody, block somebody, do it. Because I think a lot of people think, well, that's childish. I'm like, no, I'm protecting my peace.
Yes. Yeah, because I knew seeing her post was just going to seeing her happy post was just going to make me mad. And that's not fair to her because she is happy and she deserves that.
Yeah.
So I was like, nope. I'm good, because I don't want to be bitter against another Black woman just because and not to say she did it on purpose. Maybe she didn't realize the way that her words were coming across, and she thought they were helping, and they weren't. But that doesn't make her a bad person, and I wasn't going to be bitter against somebody else, so I just unfollowed and wish her the best, but not for me anymore. Yeah. So I would say for me, at about 27, 28 weeks, the sickness was almost gone. Not completely. There were still days where I was sick. So what it kind of turned into was from every single day, all day, to every other day, all day.
Okay.
3 days, all day, to where I had to figure out what day this week am I going to be in the bed. And so I started having better days where I wouldn't say I felt like myself, but I could do stuff. I could get out of the bed. I can eat. I wasn't eating normally. I still was very afraid of food. I was like, this may bring it all back. And so it was still, what can I eat? But then I had to figure out what day is going to be the most awful day for me this week. And I never knew which day it was. So what would end up happening was I'd wake up and I would know almost within like 30 minutes what day I was having. And so I'd have to cancel my sessions and just reschedule that day. Like I didn't do the hour thing anymore and give myself an hour. I was like, if I'm down to 1 to 2 days a week, I'm just canceling. Yeah. And if you can reschedule this week, great. If not, I will see you next week and we'll try it again. And by this time, everyone knew I was pregnant. In the beginning, when I was doing the hour thing, I hadn't announced to any of my clients yet. And so they didn't know that I was sitting there trying to get through this. I didn't announce until 16 weeks, I think, was when I let my clients know. And just so that they could prepare, because I knew I was going to take 3 months maternity leave. And it wasn't going to be like a few weeks and I'd be back. It was 3 months and, you're not going to see me. So I let them know a little bit early on, so that they had that time. But so the sickness kind of changed. And even my doctor was like, it normally just goes away. Why is it not going away? I was like, you're the doctor. You tell me. I'm just living it. I don't know. But so I don't know if it's the medicine that was doing its job or if it was just my body was just finally trying to adjust to all of the hormone changes. But then I went into labor early. My water broke, which, from what I understand, for a lot of women doesn't actually happen, and the movies just trick us. Yeah. But I had a very movie-esque water breaking, which, I mean, come on, with the pregnancy I had, why would I not get that? Yeah, so the whole, the woman's walking, and it's like, oh, my water broke, and you just see the gush. If I was out and about, that would have been me. So I was at home. It was 10 p.m. I was getting ready for bed. My husband was in the laundry room. He was getting laundry done because he's a night owl. I'm a morning person. I go to bed and I wake up early. He stays up late and sleeps throughout the day. So he was doing laundry. And I go to sit down in the bed and I hear this pop, and I also felt it too. What was that? And so nothing, go to the bathroom. As I'm walking to the bathroom, it's just trickling out. And I'm like, Greg, I call him. He's like, I'm coming. Just get to the bathroom and just start. So he thinks I'm about to throw up because I call him every time. He would hold my hand, rub my back, and he's like, I'm coming. Just hurry and get to the bathroom. I was like, no, it's not. I'm not sick. And he was like, then what? I was like, just come here. And so he's coming. And I was like, I think my water broke. That doesn't happen. And I was like, yeah, but it did. Like, are you sure? Is it something else? I'm like, I think I'm pretty sure. I felt that pop. I heard it. I was like, I'm pretty sure that's what just happened. And so he goes into, we need to hurry up and get to the hospital. So he's going, finding his keys, grabbing his stuff. And I was like, wait, let me call the doctor first. So call the doctor. And he's like, okay, well, you're 34 weeks. I need you to get to the hospital as soon as you can so we can slow down labor. And I was like, okay. And I was like, he says to go to the hospital. He's like, okay, well, let's go. I was like, wait, they're going to admit me if my water broke. We need stuff. I hadn't packed the hospital bag. We didn't have the car seat in the car. We had nothing prepared. I wasn't ready. And so we spent the next hour packing a bag, getting the car seat in. So I'm reading the manual on how to install a car seat. I was like, no. He's like, I can come back and get all of that. I was like, because you're going to get the wrong stuff and I'm going to be mad. So let's just do it now. And so we got everything done. We get in the car and we're going. I was like, oh, I need to eat because they're not going to let me eat. He was like, they're not going to let me. So we need to stop. Stop at Whataburger. We're in line, get food, and go. No. Whataburger's line was way too long. He was like, I'm not waiting for this. Fine. The next thing over was Taco Bell's. It's not the same. It's like, do you want food or not? I was like, okay, fine, Taco Bell. So we got food, went to the hospital, and the nurse, so from my understandings, a lot of women mistake semen for their water breaking. And she's like, when's the last time you had sex? I was like, you know how awful this pregnancy has been? The last time? I don't know. And she was like, okay, so that's not what it is. I was like, no, it's not. I'm like, yeah, I need y'all to believe me. My water broke. I heard it pop. And she's like, you heard it? I was like, I heard it and I felt it. She's like, okay. So she's like, I still need to check to be sure. So she had to be undressed. And so she lifted up the gown I was wearing. And she's like, oh, I don't need to check anything. And I was like, I told you. Like, even then, it was an hour later and it's still just like, I'm like, okay, the fluid is just coming out. And sorry to anybody who's watching this and it's grossed out. This is birth, this is pregnancy, it's all of it.
Not pretty.
No, but it's real life. And so she's like, okay, we're admitting you, but the doctor wants to slow down your labor. I was like, okay. She's like, the water broke, so you're in this environment. We're going to give you an antibiotic, make sure you don't get any kind of infection, but we're going to see if we can slow it down for a day or two. And I was like, okay, I'll just go along. So I had planned a natural birth. I wanted to be able to walk around. I wanted to be able to use a birthing ball. And by natural, I mean non-epidural. Every birth is natural, a non-epidural birth. And all of that just got derailed because my water broke. And so I was really, I was upset about that. So I'm like, okay, so I had this awful pregnancy. And then of course this happened, but now I can't have the birth I want. I'm like, why is this, so again, I'm upset. And I'm laying in the bed. They give me magnesium which is a muscle relaxer, which is supposed to stop the contractions from happening. It doesn't work. It didn't work, not even for 5 minutes. My contractions just came on and kept going. And I was like, can I please get up and walk? Like I'm starting to feel it in my back and I really don't want to. She's like, I already gave you magnesium. You can't get up and walk. And please, like, can I do anything? She's like, no, if you fall and hurt yourself, that's on me. She's like, I cannot let you out of this bed. So what can I do? She's like, get through it. Really? Like, there's nothing else. And she's like, of course, we can give you pain medicine, but I mean, get through it emotionally that you're not getting out of this bed. And I was like, okay. So I had to deal with that, which was not what I wanted, but, most people don't get the birth they want. You just get your baby. So, get through it, Brittney, move on and get this baby here. And so they gave me 2 rounds of magnesium to stop labor, and it didn't work. She said, I'm coming. I'm here. Let's go. I did my best to get through it. I told the nurse, okay, give me an epidural. I want it. I'm not doing this. This is painful. Y'all won't let me out of this bed. It's making me angry. And all I want to do is walk around and use a birth ball and you just won't let me. And she said, okay, well, the epidural you're not going to get it in 10 minutes. Probably going to take about an hour for you to get it. Well, what can I have now? And I had gotten Dilaudid. I've never, ever in my life had a pain medicine that strong. Mm-hmm. I started crying and told my husband, I think I'm dying. He's like, what's wrong? I said, I don't know, but I feel woozy and I don't think I'm supposed to feel like this. It was just a high from the medicine. The nurse came in and I could tell she's trying not to laugh at me. She's She's like, Brittney, you're not dying. I said, then what am I feeling? She said, have you ever had a narcotic pain medicine? No, I've never had any kind of surgery. And she's, I can see in her face, she's trying not to laugh. Like I remember this, but I know, like, actually looking at me, I must have just been the most ridiculous person. And I was like, my head is feeling like this, and I'm not even explaining it. I'm just like twirling my head. And then I start crying. I was like, what's wrong with me? Is the baby okay? She's like, everything is fine. It's just the medication. And I laugh now, but in the moment, I really was scared.
Yeah.
And so they gave me Dilaudid, and that really took the edge off. It didn't take the pain away, but it just felt now like I was having cramps and not really back contractions. And when my doctor finally got there, and so it's like the next morning, I'm skipping a lot to like make this not super long, but basically I have a contraction, and I would go to sleep for like 2 minutes, and then I'd have a contraction and then sleep, and then like, so I was sleeping for a minute to 2 minutes at a time in between contractions. My doctor finally gets there the next morning at 7. So we got to the hospital about 11 o'clock. My doctor gets there about 7 a.m. He's like, and I'm waiting for the epidural at that point. They had prepped me. They gave me the fluids. So we were just waiting on the anesthesiologist to get to the room. And he's like, you're at a 7.5. You're almost at an 8. He said, and then just dilated. Okay, you can cancel the anesthesiologist. We're doing this. Like, let's go. Let's go. And so I did get to have my birth without an epidural like I wanted. But she came at 10 a.m. So my water broke at 10 p.m. She came at 10 a.m. the next morning. So 12-hour labor. But so my entire pregnancy from 6 weeks to 34 weeks was nothing I expected, nothing I wanted, nothing I had prepared for. It all was just, I'm in the passenger seat, just waiting to see what's going to happen.
Yeah. Well, how were you after that? After it was finally over, how were you?
It was a huge, huge relief. Like huge relief. So she was born early. They immediately took her away from me. So they laid her on my chest, and I got to touch her and look at her and talk to her for maybe 2 minutes. And they're like, Mom, we have to take her down. Okay, fine. They were worried about her lungs. Because she was early, the lungs is one of the last things that fully develop. And so they wanted to make sure that she could breathe on her own and didn't need assistance. So they took her away. They let my husband take her to the NICU, which is what I want. It's like, can he just go? And yes. I was like, hey, go with her. He said, what about you? Go with her. She's new. I'm fine. And so I didn't want her to be alone. Like in my mind, it was like, they're taking her away from me. She's all alone in this brand new world. And now she doesn't even have her mommy. You need to go with her. But my body and like my emotions and like, just like feeling sick and everything, honestly, like it almost immediately went away. Mm-hmm. Like, it's amazing how like my body already knew, okay, we're done. We can go back to normal now.
Yes, it does. It's just like everything that you felt is like gone.
Almost instantly.
Mm-hmm.
And I was worried about, so I had perinatal depression. Mm-hmm. Okay. I was worried about PPD, postpartum.
Yeah.
And I thought if I had it that bad then, and I did nothing about it, like I was that sad, I was that miserable, I had automatic negative thoughts, terminating a pregnancy, which I never wanted to do. Like I had classic symptoms of depression. I thought PPD was going to be bad, and I didn't get any, like there was no negative emotions there, nothing with PPD. And I already had my therapist on, I had already scheduled my sessions out with her until February, thinking, okay, if this happens, I did nothing during my pregnancy. I didn't even tell her about it. When I finally told her, she's like, how come you didn't say any of this? Because I was being logical in my head and just trying to talk myself through it, which was the wrong thing to do. But we had already planned out my sessions when I was going to come in, what we're looking for, and to make sure that I didn't do what I did during the pregnancy, because then the baby would be here. But nothing came up.
Mm-hmm.
Yeah. What else? Okay.
Good. I'm glad.
Yeah, I am too. I am too. But it's just, I don't know, just like what actually causes this stuff. I know it's hormones,
Mm-hmm.
but with the way that I had all the hormone fluctuation in the beginning, I
Mm-hmm.
thought that I was going to have, the opposite reaction, that they were going to drop really quickly. And, then I would have kind of the same thing because they rose super quickly. But then I don't know, I didn't have anything. So I don't know, it just makes me curious, like why does this happen to some women and not other? Why did it happen to me during the pregnancy but not after? Like, I don't know.
Yeah. Well, it varies from person to person. So it sometimes it's hormones, sometimes it's genetics. So if you have a family history of any type of mental health issues or a family history of postpartum or perinatal depression, that can also be a factor. Being a woman of color, especially a Black woman, you are at higher risk. We're actually 2 times more likely than our white counterparts to have a perinatal mood and anxiety disorder. But a lot of times we don't even, because of lack of education, we don't, and then of course stigma, we don't know that the symptoms that we're experiencing is related to that. We think we just have an attitude, or we think it's, just stress from work, or, I'm tired of all my other kids, or my husband's just getting on my nerves. We just think we think it's something else. We don't attribute it to a mental illness. And then, of course, high risk pregnancies, the hyperemesis, any type of, if you've had physical health issues prior to pregnancy, that is a risk factor. Military moms. There's so many risk factors that can contribute to that. So it really varies from person to person. And like you experienced it during your pregnancy, but not after. I experienced it during my pregnancy and for a few months after. So it's every person is different in how I think what helps is, part of it is mindset. Part of it is educating yourself, having a support system, a positive support system. And then a lot of it comes down to nutrition and exercise. And there's just a variety of things that can help you to prevent or make your symptoms, less intense. So it just kind of varies from person to person. So there's really no exact science to how this happens or why it happens to some people, but it happens more often than we think. Because the statistics say 1 in 7, some of them say 1 in 5. It may be even more than that, but like I said, because we attribute it to other things, and because of stigma, and a lot of times it goes unreported.
Mm-hmm.
And so I think that's why it seems so far and few in between. But I think it happens even more than the statistics say.
Yeah. Yeah. And that's one of the reasons why I wanted to, get you on this call, because I think women only talk about the happy parts of pregnancy, and it's so beautiful and it's joyful, and I love this, and just the excitement about it, which are all great. Like, don't get me wrong. I know I talk about it with like that voice just because I'm still bitter about my own pregnancy, but those things are beautiful, and I'm glad women get to experience that. But on the flip side, there's me, like who don't ever get the joyful part. But I think that we don't talk about it enough. We don't talk about how hard pregnancy is, how, for me, how awful it can be, how like all of the changes that are truly about to happen. Because I remember one thing my husband would say is like, "You didn't know this was going to happen?" I said, "I knew about morning sickness, but there's no way this is morning sickness."
Yeah.
Like, there was no amount of preparation or knowledge that would have prepared me for what I went through.
Exactly.
And
Even like if we get stories from other women, like our mothers or grandparents, or it's still your individual experience.
mm-hmm.
every pregnancy is different. So this pregnancy was rough. If you do decide to have another baby, that might be heaven on earth. Like it can really, when I tell you the difference between my first pregnancy and the second pregnancy was like night and day. And they act like that now. They're like night and day. My daughter acts like how my pregnancy was. So yeah, like it can vary. It's really mind-boggling how, like you said, there is no preparation. Like you can read all the books, you can watch all the YouTube videos, but this baby is gonna have a mind of its own. Your body's gonna do its own thing. You are not in control.
Right. Yeah, I was a backseat driver trying to control it, and clearly I just needed to shut up and just let it happen. But yeah, I do. I agree with that. You can't truly prepare for what your body's about to go through because you don't fully know what experiences you're going to get. Because there's a lot of stuff that other women have experienced that I didn't go through at all. And so you don't know. But I think having the knowledge that these are things that can happen will help a lot of people, because I didn't know that you can have depression during the pregnancy. I thought it was all just postpartum. I didn't know about hyperemesis. I thought it was just morning sickness and, 12 weeks it goes away. I didn't realize people have it all the way through. I didn't realize it lasts longer. I didn't know hyperemesis was a thing. Like, just having the knowledge that these are possibilities, I think can help people once it actually comes up. Like, okay, this is what it is. I just have to get through my own experience.
Yeah. And then also, I think what would be helpful is acknowledge your expectations, but also be flexible in knowing that just because I expect this doesn't mean it's going to happen. And if something different occurs, it's okay. And I can get through it, and building up that support. That's why like support groups are so good for women who are pregnant or postpartum. I think it's been difficult for me to start up a group. I don't know if it's just because of fear of confidentiality or just fear of like being vulnerable in front of other women, but hopefully when people see this, maybe we can kind of open the door for more discussions and just feeling more comfortable with talking about these types of things.
Yes, hopefully. Because I saw someone else post on Instagram about her. I don't remember her exact wording, but she has a group, or she was a part of a group of women who were all around the same due date. Yeah. And I thought that was really cool, because then she talked about some of their experiences, of course, without naming anybody, but, she had them to kind of piggyback off of and understand what they were going through, and to talk to, and to be a support system of just other women who will give birth around the same time. And so you kind of get to go through that with them. I think that would have been great if I had that same thing. But knowing that groups are out there like that, I think, it needs to happen more.
Yeah, definitely. So there's an app called What to Expect app.
Mm-hmm.
And they actually have message board groups on there.
Yeah.
And then also Postpartum Support International on their website, postpartum.net. They have like a group for any mother you can think of. They just they're virtual, and they have them on a weekly basis. So they have NICU moms, they have military moms, they have a group for dads. So there's several groups. There's for Spanish speaking mothers, they have one for them. There's one for everybody.
Nice.
So that's a good resource to have as well.
Nice. Yeah. That's good. I did join the What to Expect group, and that was good, kind of seeing the questions and being able to ask my own questions, and getting feedback from other moms. But having like a group of like maybe 5 or 6, and them and you see them and you know their names, will create a different kind of support.
Yeah.
But yeah, I like that the other one has like calls and stuff.
Yeah, there's actually a midwife out here in Shreveport. Her name is Jamie. She's the midwife over Bonfit Maternity.
Mhm.
And so she, or Bonfit, I'm not good with French, but but she actually will do groups usually with all of her moms that are due around the same time.
Yeah.
And I think that is definitely helpful to just be like, okay, I'm not going through this by myself.
Yeah. Yeah. That's awesome. Yeah. And then, of course, I was pregnant during COVID. So add COVID on top of everything I experienced. Yeah. The burn on top of all of that. And yeah, and then just squish it together.
And it felt like, oh my gosh, I've told my mom this. I was like, I don't know. I would be literally a nervous wreck if I had been pregnant and have gone through all of those things I went through with COVID. So kudos to you. Like,
yeah.
Kudos to you and all the moms in 2020. And, you know, even in the start of this year that are delivering their babies and not being able to have, you know, more than one person in the room with them, and all of those expectations goes back to that, you know, expecting for your mom to be there, and you have to choose, you know, between my husband or my mom, or, you know, and so that can be another strain on your mental health. So
yeah. And then on top of that, in the beginning, that when I discussed the twin, my husband wasn't allowed in the sonogram. I got all of that information all by myself in that sonogram room because they didn't let him in. So he's in the car waiting, and so I text him and I was like, it was twins. And so he's waiting in the car to see if it was still twins. He's like, so it's twins. It's like, when I said it was, he wasn't in the room. He didn't understand that I had already gotten the information that it wasn't going to be. He's in the car waiting like, oh my God, we're having twins. It's going to be. So, you know, that wasn't fair either. But again, COVID is right on top of everything. But we can wrap this up so we don't go over an hour.
Okay.
Thank you so much for just having this talk with me. I hope that it helps another woman through her pregnancy. If you use the word awful to describe your pregnancy, I hope that this helps you kind of get through it and gives you a voice to know that it's okay to feel that way. You are not wrong. You're not a crazy person. It doesn't mean you don't love your baby. I've heard women talk about how when you see your baby or they're finally here, the amount of love that you feel for them, the amount of protection. And even though my pregnancy was the worst thing I've ever experienced, that love came on so strong, and I will do anything for that little girl. But I never want to be pregnant again. And so I